Hi there. Thank you once again for joining me on the program, Your Doctor and COVID. I am Dr. Mahendra Carpen. I'm the head of medical services and cardiology at the Georgetown Public Hospital Corporation. We continue our conversations around the COVID-19 pandemic, how it affects you, how it affects your family, what it has been doing to our country. Today, we continue to answer questions and comments from viewers and listeners just like yourself. Remember, if you have any questions or comments, feel free to send a WhatsApp message to 620-6275, or you can send an email to docandcovid@gmail.com. We've been getting a lot of feedback, a lot of questions, a lot of comments, and many of them are similar in terms of their contents and the concerns being expressed by viewers and listeners just like yourself. So we wanted to group a couple of those and answer some of the main questions or concerns that were expressed. Usually when we start our conversation, I would have my mask on and then take it off. But for today's episode, I wanted to start off without the mask just to demonstrate how we put it on, and then I will take it off. I will take it off at the end of that demonstration because I'm alone in studio, so I don't pose any harm to anyone around me, and I myself am not at risk from anyone who is close by. And the risk that is posed by others around you, remember, it's a minimum distance of 6 feet away from each other that you have to maintain the social distancing. And if you are closer than 6 feet, then you are potentially exposing yourself or exposing someone around you if you or them are positive for COVID-19. So we'll show how to put on the mask by grasping the straps that usually go around the ears. And both straps are taken, one in the left hand, one in the right hand. And then you'll put the mask over the face so that it covers both the nose and the mouth. When you do that, then you will secure it behind your ears. We try not to touch the surface of the mask, like the parts that are actually covering the face. Make sure when you are wearing it, it is covering the nose and the mouth, because the nose and the mouth are portals through which bacteria and other infectious material can enter or exit the human body. So this is how we put it on. We take it off in pretty much the exact opposite way with lots of similarity. Again, we grasp the straps that are going around the ears, we take it off, and then that's it. We do not touch the surface or the part that's actually covering the face, the nose or the mouth. It is advisable that immediately after doing that, you then sanitize your hands by washing or using the alcohol rub. So I hope that would have clarified the proper way of putting on and taking off your mask. We are now towards the end of December 2020. It's been a tough year, and many of us are here with, lots of gratitude, and some of us would have lost loved ones and lost those around us who we've cared about during this COVID-19 pandemic. Not necessarily due to COVID-19, but for all of us who are here, we want to be grateful for the opportunity to be here. And to those who have lost loved ones, we want to express our deepest gratitude for your patience, and we want to express our deepest condolences for the losses that you would have suffered. As we speak now, the Ocean View facility at Liliendal has 7 persons in the ICU. 6 are adults, and we have 1 child. Out of the 6 adults, 1 person is actually intubated. Intubation basically means that person is on a ventilator, and the ventilator is providing respiratory support because they themselves could not maintain their proper oxygen saturation while breathing on their own. So ventilator is there to help patients, and we are wishing this person and their family all the best and hoping that there is a full recovery for all of the patients who are in the ICU right now at the Liliendahl facility. In the festive season, it is very common in Guyana for persons to follow the edict of eat, drink, and be merry. And among the drinking part of that is a lot of consumption of alcohol. And so it's very appropriate at this time, the question that actually came in from one of our viewers or listeners. And here is the question: how does alcohol weaken the immune system? Very important question. And the second part, is there a limit or should it be strictly prohibited? Very important question, very timely question, especially in the festive season. And there are some things that we know for sure about alcohol. So I want to share with you a couple of facts. This is what is known, and we do not need to debate it too much, but here's the first set of facts. Alcohol has effects, both long and short-term effects, on almost every single organ in the human body. Overall, there is no safe limit. It varies from person to person, so it's difficult to say, well, 1 glass, 2 glass, 1 bottle, etc. So there's no safe limit that has been recognized. The risk of damage to your health increases with each drink of alcohol that is consumed. Let that sink in. Alcohol use, especially heavy use, weakens the immune system, and thus when the immune system is weakened, it therefore reduces our ability to cope with infectious diseases. Infectious diseases caused by bacteria, by viruses, parasites, etc. And as you know, the coronavirus is one such infectious material that can cause a lot of problems. Alcohol can affect people from head to toe. And we look at what can happen in these patients. There's an increased risk for head and neck cancers, increased inflammation of the brain or neuroinflammation, increase in breast cancer. There is increase in hepatitis and hepatocellular cancer. That's cancer of the liver or inflammation of the liver. There's an increase in pneumonia or infections of the lung, increase in pancreatitis or pancreatic cancer. There's increased inflammation in the stomach that is called gastritis. Overall, there is a complete weakening of the immune system due to the consumption of alcohol. So that should answer the second question very clearly, is there is a safe limit or it should be totally prohibited. Here are some other facts for you. Alcohol, even in small quantities, is known to cause cancers. Small quantities can cause cancers. It alters your thoughts, judgment, and decision-making behavior. And this is very important in the festive season. If you are consuming alcohol and you start to feel good and nice, and then all of a sudden the mask comes off and you're greeting friends, family, especially in bars and public spaces, that can put you at risk. And if you are infected, you can put those around you at risk. Alcohol, even in small amounts, is a risk to the unborn child at any time during the pregnancy. not just the early parts, not the mid, not the late, any time during the pregnancy, alcohol can put the unborn child at risk. The WHO has certain specific approaches to alcohol consumption, and especially during the COVID-19 pandemic, their advice is to stay healthy at home, avoid or reduce alcohol consumption. And again, they're reinforcing that it can affect your mental state and judgment, as well as increase the incidence of symptoms suggestive of depression, anxiety, and fear. We're all fearful of the COVID-19 pandemic. Alcohol can actually increase that fear, the anxiety that is associated with the COVID-19 pandemic. And again, they're reiterating that alcohol can weaken your immune system and should be avoided, particularly during self-quarantine. I hope that answers a lot of the questions related to alcohol. Here are some more facts being thrown at you. Alcohol increases the risk, frequency, and severity of interpersonal violence. That's violence in the home especially, such as intimate partner violence, sexual violence, youth violence, elder abuse, and violence against children. It can increase the risk of death and injury from road traffic injuries, drowning, and falls. Heavy use of alcohol also increases the risk of acute respiratory distress syndrome, or ARDS. And this is one of the more severe complications of COVID-19. So if you have alcohol already putting these patients at risk for ARDS, and then you add COVID on top of it, it is a double whammy, two lashes to make sure to worsen these patients' conditions and worsen their outlook in general. Some myths about alcohol that need to be addressed are, we have a lot of beliefs around alcohol, and some of it's true and some is false. Here are a couple things that are false. Alcohol destroys the virus that causes COVID-19. Consuming alcohol does not destroy the virus. It actually weakens your immune system. Alcohol at concentrations of 70% or more can be used to clean surfaces and sterilize hands when part of hand sanitizers. That is how alcohol can be used, to clean surfaces and to sanitize your hands. Another myth is that drinking alcohol or strong alcohol kills the virus in inhaled air. That is not true. And in our context in Guyana, our strong alcohol are things like high wine. Even though the percentage of alcohol in high wine is very high, drinking high wine does not kill the virus in the air that you breathe in. Another myth we need to dispel: alcohol stimulates immunity and resistance to the virus. Absolutely false. As I've said before, as we've discussed extensively, it does not stimulate your immunity. In fact, it weakens your immune system. The WHO have, again, been very clear about their recommendations on alcohol. You should avoid alcohol altogether. If you must drink, keep it to a minimum. The immune system is weakened by alcohol, especially if you drink heavily. You should reduce your alcohol consumption because alcohol reduces your ability to cope with infectious diseases. Alcohol can cause acute respiratory distress syndrome, and drinking also increases the risk of domestic violence. That is quite clear. So to summarize all of this that I've said about the consumption of alcohol as it relates to the immune system and particularly the COVID-19 pandemic, under no circumstances should you drink any type of alcohol or alcoholic products as a means of preventing or treating COVID-19 infection. Alcohol can reduce your immune system by affecting all of the cell lines that you require that fight off infections. In your gastrointestinal tract, when you consume the alcohol, it changes the normal bacteria that live there that actually helped you to fight off infections. And in the respiratory tract, particularly important for this COVID pandemic, it reduces the immune ability in the respiratory tract to fight off infections from getting into your lungs. So I hope this would have answered the two questions that were posed as it relates to consumption of alcohol and COVID-19. Thank you once again for joining me, for watching or listening. Remember, if you have any questions or comments, please feel free to send a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. Thank you and have a wonderful holiday season.